Imagine the profound grief of losing a beloved, incredibly valuable mare. And then maybe a glimmer of hope, a groundbreaking way to ensure her genetic legacy lives on even after she's gone. It's a very precise, time-sensitive dance between cutting-edge science and, well, absolute urgency. Welcome to our deep dive into equine post-mortem intracytoplasmic sperm injection, or ICSI. Now, this isn't just a mouthful of complex words. It's a powerful assisted reproductive technique. It allows us to collect oocytes, those are the mare's unfertilized eggs, from her ovaries after her death or euthanasia. These oocytes are then fertilized in vitro, in a lab setting to produce embryos. The why behind this is critical. This procedure serves as a really vital tool for preserving the genetics of high-value mares who might pass away unexpectedly or perhaps are euthanized due to health conditions completely unrelated to their reproductive capabilities. Our mission today is to truly unpack the incredibly precise journey involved, from those immediate moments after death all the way to the specialized laboratory. We'll explore the challenges, understand what it genuinely takes to make this extraordinary process a success. It's a fascinating look at how veterinary science pushes the boundaries of what's possible.
That's precisely it. ICSI has indeed matured into a clinically viable method for producing embryos and ultimately foals in horses. And its specific application post-mortem is a remarkable opportunity, really, to secure foals from oocytes recovered from ovaries, even after a mare has passed.
Okay, let's unpack this a bit. So it's not just about producing a foal, but it's fundamentally about preserving a genetic line, one that might otherwise be lost, right?
Exactly. The core value, as you've highlighted, is genetic preservation. This is especially true for mares experiencing sudden non-reproductive deaths, accidents, things like that. Without this procedure, their valuable genetics would simply stop. They couldn't contribute to the breeding pool anymore. Postmortem ICSI offers a path to continue that lineage.
Okay, here's where the race truly begins, I imagine. The immediate aftermath of a mare's passing is absolutely critical, isn't it? Speed and precision on the ground seem paramount for this first phase. Can you walk us through that race against time in those initial moments?
They are indeed the absolute keys.
Yeah.
The most critical factors for successful postmortem oocyte recovery are speed and a clean technique. You want those ovaries removed as quickly as possible after the mare's death, ideally within a narrow window, maybe 2 to 6 hours, to maximize the viability of the oocytes. And while, maintaining a perfectly sterile environment is important, it's understood that in an emergency field setting, perfect surgical sterility might not always be achievable. But a clean approach is vital. Definitely.
Right, you do the best you can in the circumstances.
Exactly. Now, the supplies needed are relatively straightforward for a field procedure. You need sterile surgical gloves, a sharp scalpel, large surgical scissors, and crucially, sterile saline solution. We often use lactated ringers or maybe an embryo flush solution. It must be at room temperature. That's key, not cold.
Room temperature saline, got it.
You'll also need several clean, leak-proof plastic bags like those heavy-duty freezer bags work well, an insulated container for transport, and some absorbent material, to cushion everything.
Okay, so what about the actual procedure right there, on site?
Right, so the on-site procedure after the mare has passed involves immediate preparation, just gathering all your supplies quickly. The mare should be laid on her side. While some might suggest ovary removal even before the full effects of euthanasia drugs, in most emergency situations, prompt removal shortly after death is sufficient. The impact of those drugs on oocyte viability seems to be generally minimal if you act fast.
Okay, that makes sense. Then the removal itself.
For the removal itself, it involves a careful, swift surgical approach to get into the abdominal cavity. The goal is to quickly locate and gently retrieve the mare's kidney bean-shaped ovaries. They're usually up near the spine. Once identified, they are carefully detached from their supporting structures, the ligaments and mesovarium, making sure no other tissues are inadvertently removed, especially uterine tissue or fat.
Keep it clean.
Keep it clean. Each ovary is then gently rinsed with that room temperature saline to remove any blood or debris, no scrubbing, and then carefully placed into its own sealed, leak-proof bag. Both bags then go into a larger sealed bag. And this is a vital point to remember. Never put the ovaries directly on ice or in the refrigerator.
You've mentioned that. Why is that so critical?
Cold temperatures are absolutely catastrophic for these delicate oocytes. Cold shock kills them very quickly.
Wow. Okay, so avoid the fridge at all costs. Now, what's fascinating here is You mentioned there's a very different, maybe more controlled approach if euthanasia is planned in advance. How does that change things for ovary recovery?
It's a significant shift, yeah, and honestly, it often leads to better overall results because you have the advantage of preparation. For mares scheduled for euthanasia, the recommended approach is actually ovary recovery under general anesthesia immediately before the euthanasia itself.
Ah, so while she's still under, but before the final step.
Exactly. With planned euthanasia, you'd prearrange everything. That includes the logistics for transporting the ovaries, coordinating with the lab, ensuring the shortest possible journey. The mare is gently anesthetized, using standard veterinary protocols like xylazine and ketamine, and the euthanasia solution, often KCl or a commercial product, is prepared and ready for immediate administration right after the ovaries are safely removed.
There's a very coordinated sequence.
Very. The surgical site, usually the flank, is prepped like any sterile surgery, shaved and scrubbed. The ovaries are carefully located, maybe by following the uterine horn, and removed. This might involve carefully cutting the ovarian pedicle.
Yeah.
Then, just like in the post-mortem emergency scenario, they are immediately placed into a clean container, usually a palpation sleeve or plastic bag, often with minimal air and no fluid needed in this case.
No fluid this time. Interesting.
Correct. For this specific protocol, it's often bagged dry. Then, immediately into the insulated container, sometimes with a warm ballast, like something pre-warmed to 37 degrees C, to maintain temperature initially. And once both ovaries are secured, the euthanasia solution is administered.
Okay, so once they're out, whether it's post-mortem or planned euthanasia, the next big hurdle is getting them to the lab safely. This isn't just like shipping, a book, is it? Temperature control during shipment must be absolutely paramount.
You're absolutely right. It's probably the most critical phase after recovery. Maintaining the precise temperature and ensuring swift delivery are the make-or-break factors for keeping those oocytes viable during transport. And I cannot emphasize this enough. Always communicate with the receiving ICSI laboratory before you ship anything. Seriously, call them first.
Why is that contact so crucial?
Well, many labs are prepared to receive ovaries 24/7, but they need a heads up. They'll give you their specific up-to-date protocols. These can change slightly, recommend the best shipping carriers, and give you emergency contact numbers. You'll need to provide all the mare's details, her name, age, breed, and any relevant health history, like the cause of death or recent medication she might have been on.
Okay.
And of course, ensure the lab has or will receive the chosen stallion's semen. Frozen semen is typically preferred for ICSI, and it's best if it arrives within about 24 hours of the ovaries, maybe the day after.
Right, so the lab has everything ready. Now, back to that temperature control during shipping. You mentioned no ice, no fridge.
I'll say it again, avoid refrigeration or direct ice contact. It's such a common but very damaging mistake. The optimal temperature actually depends on how long the journey will take. It's not one size fits all.
Okay, so how does that break down?
For short transports, say under 2 hours, you want to keep the ovaries as close to body temperature as possible, roughly 32-37 degrees Celsius, that's 90-98 Fahrenheit. This means using an insulated container with maybe warm saline bags or warm gel packs, but, and this is important, making sure they don't directly touch the bagged ovaries. Use padding.
Got it. Warm, but separated. What about longer trips?
For intermediate transports, maybe between 2 and 8 hours, the goal is to gently cool the ovaries down to room temperature. Think around 22-25 Celsius or 71-77 Fahrenheit. You'd use an insulated container again, but this time with room temperature packs or perhaps very slightly cooled packs, again, well separated from the ovaries by padding. Allows slow cooling.
And for overnight shipping, that must be the trickiest.
It requires careful management. If you're looking at extended transport, over 8 hours, like overnight shipment, the aim is to keep them cool, but definitely not cold. The target range is usually between 12-20 Celsius, so about 54-68 Fahrenheit. Here, you might use an insulated container with just a single cool pack, definitely not frozen placed, away from direct contact with the ovaries. Some labs suggest using room temperature saline bags as a buffer around the ovaries to help stabilize the temperature and prevent overcooling.
Okay, that makes sense. Buffering the temperature change.
Exactly. And as for packaging, always use a high-quality insulated shipping container, a good styrofoam box or one of those specialized equine transport containers like an Equine or Oocyte. Cushion the bagged ovaries well with soft, absorbent material paper towels, bubble wrap to prevent them bouncing around and provide extra insulation. If you're using a basic styrofoam box, remember it needs to go inside a sturdy cardboard box for the actual shipping process. Couriers usually require that.
Right, and labeling. What needs to be on the box?
Clear labeling is vital. Mark the outside of the container clearly with the lab's full address, a contact person, and their phone number. Also, Include a bold label stating something like urgent equine ovaries for ICSI keep at room temperature, or specify the target temp range if needed. Inside, you need all your paperwork. The mare's ID, owner contact details, a summary of the health history, any specific instructions, and sometimes the lab requires a signed client contract in there too.
Seems like a lot to coordinate quickly.
It is. Finally, the shipping method. Choose the fastest possible option available. Overnight express couriers like FedEx Priority Overnight or UPS Next Day Air are typically used for longer distances. But if direct delivery, like driving them there yourself or using a dedicated courier, is feasible and faster, that's always ideal, the ultimate goal. Get those ovaries to the lab within 12 hours of the mare's death, and ideally much faster within 6 hours, if at all possible.
Okay. If we connect this to the bigger picture, I mean, while this technology is clearly amazing, it's obviously not a magic bullet, is it? What are the factors that really determine success, and what should owners realistically expect? It sounds like an emotionally and financially significant journey.
That's a critical and very honest question. You're right. While post-mortem ICSI offers an invaluable avenue for genetic preservation, the success rates can be quite variable. And generally speaking, they are lower than with oocytes collected from live mares via ovum pickup, or OPU. That's a procedure where eggs are collected directly from a living mare.
Okay, so managing expectations is key. What makes it so variable?
Several factors contribute to these challenges. The first, and arguably the most important, is the time since death. We keep coming back to this. The longer the interval between the mare's passing and when the ovaries actually reach the lab for processing, the lower the viability and the developmental potential of those oocytes. Aiming for under 6 to 8 hours to the lab is truly ideal.
Time is the enemy here.
Absolutely. Then, the cause of death and the mare's overall health status before she passed play a huge role. Mares that die suddenly from non-debilitating causes, like, say, acute trauma, generally yield better quality oocytes. Better than those who have been ill for an extended period or suffered from chronic conditions like severe colic, systemic inflammation, or chronic laminitis.
So a long illness beforehand is not ideal.
Not ideal, no. Any systemic illness, fever, or even certain medications administered before death can compromise the quality of the oocytes. Beyond that, the inherent quality of the oocytes themselves from post-mortem ovaries can just be quite variable. They might show lower rates of maturing properly in the lab, lower fertilization rates after ICSI, and subsequently lower rates of developing into viable embryos compared to those from healthy live mares.
It's just the tougher starting point for the eggs.
It often is. Also, the number of follicles available on the ovaries at the time of death impacts how many oocytes can potentially be recovered. Mares with lots of small to medium-sized follicles tend to yield more chances.
Makes sense. More potential eggs.
Right. And as we've discussed at length, shipping conditions are paramount. Suboptimal temperature control or prolonged shipping times will significantly reduce viability. That's a big factor. And finally, laboratory expertise is absolutely vital. The success of the ICSI process itself is highly dependent on the specialized equipment, the precise culture media the lab uses, and frankly, the skill and experience of the embryologist performing these very delicate procedures.
So the lab choice matters.
Immensely. Even the quality of the stallion semen, while ICSI can overcome many sperm issues, can still impact success if it's extremely poor quality or if there's very limited quantity available.
Okay, so lots of variables. What about actual numbers? What can someone expect?
Yeah, let's talk concrete results. Based on some published data, for example, from the Equine Embryo Laboratory at Texas A&M University, looking at a period between 2010 and 2015, on average, you could expect around 1.3 blastocysts. That's an early-stage embryo ready for transfer per mare attempted.
Okay, 1.3 embryos on average.
And the average full production from this procedure, looking across all the mares in that study, came out to about 0.54 foals per mare. 0.54. So roughly a 50.50 chance.
That's essentially what it boils down to on average. An owner undertaking this has roughly a 50.50 chance of ultimately getting a live foal from the entire complex process.
Wow, okay. That 50.50 figure really highlights something important. For owners, this isn't just science, it's deeply emotional and clearly a significant financial undertaking too. What do they truly need to know up front about the costs and their responsibilities, especially given those odds?
That's absolutely vital information. Decisions around a mare's death are often made in a very emotional, very time-sensitive state. So owners need a very clear, very realistic understanding of what this procedure entails, especially the potential expenses involved. But before they even consider removing and shipping those ovaries, you need to go in eyes wide open.
Can you break down those costs? What are we talking about? Sure. The costs are multifaceted. They typically include the veterinary expenses for sedating or anesthetizing the mare if it's a planned euthanasia, and the surgical removal of the ovaries in either scenario. Then you've got the shipping costs for sending the ovaries to the ICSI laboratory, and separately, the costs for shipping the chosen stallion's frozen semen to that same lab.
Okay, vet fees, shipping ovaries, shipping semen. What about the lab work itself?
Right, the core laboratory fees. These cover dissecting the ovaries, signing the ovaries, maturing them in culture, performing the ICSI procedure itself, and then culturing any resulting embryos. That lab portion can often range somewhere between, say, US $2,000 to US $3,000, maybe more depending on the lab.
2 to 3,000 just for the lab part.
Roughly, yes. And if an owner chooses to vitrify, which is essentially flash freezing, any embryos produced for later transfer, that usually adds another cost, typically around US $300 to US $500 per batch of embryos.
Okay, freezing is extra. What else?
Beyond that, if you get embryos, there are the costs for shipping the embryo or embryos to an embryo transfer center. Those are usually specialized facilities. Then you have the fees levied by that ET center for the actual embryo transfer procedure into a recipient mare, the care and board of that recipient mare, and potentially the purchase or lease cost of that recipient mare.
Ah, the recipient mare costs. That can add up.
It certainly can. Owners also need to be aware of any specific costs and rules associated with enrolling their original mare in breed-associated embryo transfer programs. These rules and fees can vary significantly by breed registry.
Right, gotta check with the registry. What about the owner's direct responsibilities in all this?
Good question. The owner is directly responsible for coordinating that semen shipment we mentioned. They need to get the chosen semen to the ICSI lab. Most labs prefer the semen to arrive the day after the ovaries land, because the actual ICSI procedure itself usually takes place on the second day after the ovaries arrive, following oocyte maturation overnight.
Okay, timing the semen arrival is on the owner.
Yes. Owners are also responsible for identifying an embryo transfer facility they want to use for any embryos produced, or making the decision early on to vitrify embryos for future use. And importantly, the client, the owner, should communicate directly and clearly with the ICSI laboratory throughout the process to clarify any specific costs or procedural questions related to the lab's services. Don't rely on intermediaries for everything.
Direct communication sounds key. So we've really explored the intricate, urgent, and deeply specialized process of equine post-mortem ICSI today. It's a true testament, isn't it, to the remarkable advancements in veterinary reproductive science. It offers a powerful tool for genetic preservation despite all those inherent challenges and, that realistic 50.50 success rate we discussed. So here's a final thought to leave you with. Considering the incredible precision required, the biological fragility of these cells, and the significant emotional and financial investment needed for success, what does the very existence of a procedure like postmortem ICSI reveal about how far reproductive science can actually push the boundaries? And maybe how might these complex ethical and logistical considerations shape the future of genetic preservation efforts, not just for horses, but perhaps for other species as well?